surge is coming.
We must absolutely implement stronger measures to avoid the type of results that we are seeing in places like New York City.
There are now nearly 40 deaths in Ontario from COVID-19. We've had the largest single-day jump in cases since the outbreak began, and officials are warning things could soon get much worse. Good evening, I'm Dwight Drummond. Welcome to viewers in Windsor and those right across the GTA. There are 426 new cases of COVID-19 in the province, and the number of people who have COVID-19 in Ontario's intensive care units also continues to rise, which is why we want to focus on those ICU numbers tonight. Lisa Shing now with those details.
There's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain.
That devastation Ontario's premier is referencing. Hospital ICUs in those countries overwhelmed with patients. In the worst of it, doctors forced to choose who to treat. In Ontario, officials say they're doing all they can to avoid a similar situation.
We are certainly prepared for an increase. We are planning that capacity both in terms of the equipment, the hospital space, and health human resources.
The number of COVID-19 patients in the province's ICUs is doubling every 4 days. Numbers released today show 145 COVID patients in ICU beds and 340 suspected cases. That's a 16% jump from the previous day.
We need to get on this because we're going to have a lot of people die, and we don't. The die may be cast to some extent for the coming few weeks, but we really need to be doing a better job of this.
Doctors like David Feisman want widespread testing so cases are caught earlier, because if the numbers continue to increase, Ontario's ICU capacity won't be nearly enough. Currently, the province has about 2,000 ICU beds. The latest figures show about 1,600 are already occupied. Not all are COVID patients.
And even though we know we have residual at this time to handle, that's not satisfactory because you want to look at the projections based on our experts who are telling us on various modeling tools what we might, could, or should expect in the next week or two.
So far, Ontario's officials haven't publicly released any projections as to how many cases we'll see at our peak, and of those, how many will end up in hospital. Dr. David Williams says he'll try to get numbers for the next few weeks by early next week. Lisa Shing, CBC News, Toronto.
There have been 6 more COVID-19 related deaths at a long-term care home in Scarborough. In total, 8 residents have died at Seven Oaks. It is one of at least 26 Ontario facilities declaring outbreaks of the virus. Meanwhile, 2 more residents have died as a result of COVID-19 at the Pinecrest nursing home in Bobcaygeon. 24 staff members at the home are infected. Earlier today, CBC News spoke with an attending physician at Pinecrest about the dire situation there.
This is a devastating illness. I can't describe just how quickly these people become sick. I've been doing family medicine for 30 years and in nursing homes for all of that period. I've never had so many deaths in such a short period of time. We've been through influenza epidemics going through the homes and maybe lost a patient or 2, but nothing like what we're seeing at Pinecrest. This is just unprecedented. And one of my patients died this morning early. I spoke with the daughter yesterday, and granddaughter, pardon me, and had to explain, her mother was quite elderly, and we would provide supportive care, and we did. She was comfortable to the end, passed this morning.
So far, 14 residents of the home and 1 volunteer have died, and the doctor says there will be more deaths. Dr. Oldridge added that outbreaks are difficult to contain in nursing homes because they are not set up like hospitals, which have the ability to isolate 6 residents. In Bobcaygeon today, there was another show of support for the nursing home staff and residents. People in the area have been taking to their vehicles all week, driving by, honking to show their support for Pinecrest. Toronto's top doctor says she doesn't like the trajectory the city is on when it comes to COVID-19 numbers. There's been a 500% jump in cases in a 2-week period. Greg Ross joins us live with the details on new measures to help keep people at home, which is where Greg is tonight. Greg.
Yeah, well, Dwight, today Toronto's Chief Medical Officer of Health, Dr. Aline de Villa, focused in on people who present the highest risk of transmitting the virus, people who have either tested positive or people who may have potentially contracted COVID-19. She says it's no longer a suggestion that they self-quarantine. It's now an order.
Given these unprecedented circumstances, I shall be issuing class orders under the Health Protection and Promotion Act.
Toronto's Chief Medical Officer, Aline de Villa, says it's her obligation to use the power she has to slow the spread of COVID-19, which is why today she issued this class order.
So it identifies a group of individuals. And in this case, what we are talking about are people who have COVID-19 infection, are suspected of having COVID-19 infection, or those who are at high risk, close contacts of those who have COVID-19 infection.
Anyone who falls into that category is now under order to self-quarantine for 14 days. Those who fail to comply risk facing fines or possible arrest.
We have had to use those before in respect of communicable disease control. My hope is that we do not have to go there.
Mayor John Tory says he also drafted a new bylaw to enhance physical distancing restrictions.
And we've not brought that bylaw forward at this time, but it is drafted. And if it's necessary for us to use it in order to try and create a greater sense of adherence to these very reasonable recommendations.
He says it would add another layer of restrictions on top of those that have already been imposed.
Could apply only to city property, which is a large part of the city, the sidewalks, the streets, the parks, and different places like that. And of course, any bylaw does have to contain some sanctions in the event that people don't follow it. And of course, there would have to be some enforcement undertaken.
Now, the mayor says he hopes he never has to enact that bylaw. He would prefer that people police themselves when it comes to these guidelines that health officials are putting forward. But there already has been some enforcement when it comes to physical distancing guidelines. People have ignored the city's orders to close parks and all the amenities that are associated with them. And according to Toronto Police, they have already handed out 14 tickets for $750 each. They've also handed out 2 summons to restaurant owners who did not close after the city ordered them to. Dwight?
Greg Ross reporting from his rooftop tonight. Thank you, Greg. A temporary unit is being built at the Joseph Brand Hospital site in Burlington. The pandemic response unit will house 93 beds. The hospital says it is building the modular structure to prepare for a surge in patients they are now anticipating. The unit will be staffed by 8 to 12 family physicians who volunteer from the local area. The city of Windsor has laid off hundreds of employees as they continue to deal with the effects of COVID-19. CBC Windsor host Chris Ensing joins us now. And Chris, what kind of city jobs are we talking about here?
Dwight, we're talking mainly people who would usually work at arenas, pools, or community centers. Now, they're already closed here in Windsor. 2 weeks ago, during the state of emergency, they were sent home, and now they're being told that they are not coming back. But there are some who are being invited back to work. Let's break down the details here for you now. There's 543 people that have been laid off or told their hours are going to zero. It's mainly seasonal or part-time workers, and they're almost entirely union positions. 250 people who were sent home last week have been asked to work in different roles, coming back to work, and they're needed, but will be using that physical distancing model, and they'll be doing things like cleaning off surfaces or screening entrances. There's about 325 people who are able to work from home. Now, the mayor stressed that this wasn't about savings and that the union is on board with this. It's all about trying to make sure that people are staying safe. However, this will save $135,000 a week in a city budget. He could not say when these people might be able to return to work.
None of us know. And so I think it's fair to say we're all dealing with the situation that's in front of us today. Could things even change, a month or 2 months down the road? Maybe. But we're trying to deal with the situation we see at least over the next month and make reasonable decisions on how we're going to position this organization to continue to function.
Now, Transit Windsor employees are still being paid, but the service is no longer being offered. It's under a temporary suspension that started on Monday. Mayor Drew Dilkens shut down the bus service. Today, we learned that there were about 4,000 to 7,000 one-way trips that were happening last week. That's down 77%. And the mayor announced that the service would be suspended starting on Monday. The mayor said it was to save lives, to stop the spread of COVID-19, but people have criticized the move, worried that essential service workers now can't get to their place of work. Council met this afternoon, passed a program that will essentially refund people who bought 15 or 30-day passes. An opposing councillor called that insulting. The mayor has suggested that people will turn to cabs or volunteers to get rides to essential services, but one local cab company told us that about half their drivers are off the road.
Nobody want to drive, and not only because of health and other reasons, could be financial, because there isn't enough people requesting services. So you could be sitting on the road for 12 hours, you wouldn't be making $20 a day. So lots of people made the choice not to drive as well.
Locally here in Windsor, Essex, we were told of the first death, COVID-19 positive person who had died in our region. And we just had some breaking news come into our newsroom here, Dwight. There are currently 2 outbreaks at long-term care facilities in our region. One at Country Village Homes in Woodsley, 2 staff testing positive for COVID-19 there. And another outbreak at Amica in Windsor. That's after another staff member tested positive at that long-term care facility. We have more of these details on our website at cbc.ca/Windsor.
Chris, thank you. There's been an outbreak of coronavirus cases at Mississauga's Credit Valley Hospital. 4 patients have contracted the virus and have been transferred to a unit exclusively intended for patients with COVID-19. The hospital says it's taken immediate precautions to protect patients and staff and is monitoring all patients for symptoms. The hospital has not allowed visitors in since March 20th. There are strict no-visitor policies at hospitals to try and stop the spread of COVID-19. Those rules are especially tough for families dealing with someone in palliative care. Lorena Redekop spoke with one family going through the painful process of saying goodbye.
Julia Nardi and her family had been visiting her dad in hospital every day before the COVID restrictions. Sam Nardi is in palliative care with colon cancer. She or her brother would sit with him for hours.
We're doing as much as we can in terms of video calls, but it's just not the same as being able to hold his hand.
She understands the no visitor policy given the pandemic, but it's still hard.
We speak to him every day. Whether he answers the video call or not is a different story. You know, he might not look 100% great, but we don't really care about that. We just want to speak with him.
Up until January, her dad was healthy, loved music and playing his guitars. Then he noticed a sharp pain in his back.
He worked in a tire manufacturing warehouse and he had lifted a tire and he thought he had pulled a muscle in his back.
A month later, they discovered it was caused by one of 4 tumors, cancer that had spread.
The patient must be imminently dying with 48 hours to live for us to see him, which is really, really difficult because in these moments we just want to be with him.
Her mom, Mary, is also going through chemotherapy, recovering from breast cancer. That's what the family was focused on before. Given her health, she'd be considered at risk visiting a hospital. The family is already thinking ahead to those final days.
When that time comes, I don't think she'll take no for an answer. I think what we'll do is just suit her up accordingly, take all the precautions that we need, gloves, hazmat suit.
Not the goodbye anyone could have imagined before, but now it's the only choice. Lorena Redekop, CBC News, Vaughan.
As individuals, we might be led to thinking, well, if I'm the only one going out, it's like being at home. I'm isolated. But if everybody thinks the same way, then we get a little in a tricky situation.
After the break, why people may disregard social measures like self-isolation if their government announces long-term measures. Stay with us. We'll be right back. The City of Toronto is enacting stronger measures to keep people inside and is looking at getting tougher on people who don't practice physical distancing. But new research suggests that people are more likely to break the rules if isolation measures last longer than they expect. Natalie Collada explains.
Today, the warm weather proved too hard to resist, drawing some to parks despite their closure in an attempt to encourage physical distancing and stop the spread of COVID-19. Isolation orders that the mayor extended today.
Assume it will likely be up to the 12 weeks that the doctor has outlined, with temptations not to follow these measures increasing as the weather improves. We must show strength in sticking to this game plan so that by the time summer comes, we have turned an important corner.
To get there, experts say managing expectations will be crucial.
Suppose I tell you it's going to be only 2 weeks, right? And this sets my expectations. So I expect it to be 2 weeks. And then all of a sudden I say, actually, it's going to be 3 more months, right? So this is a mismatch with my initial expectations. And it's much longer than I expect. It's a negative surprise. So I feel a more sort of a negative attitude toward these rules, and I may take more transgressions.
Nico Leistera is a professor at the University of Toronto. He co-wrote a working paper looking at the physical distancing compliance in Italy. Surveying nearly 1,000 people, he found if distancing measures are longer than expected, there's a lower willingness to comply.
As individuals, we might be led to thinking, well, if I'm the only one going out, it's like being at home. I'm isolated. But if everybody thinks the same way, then we get a little in a tricky situation.
Hoping for the best, but planning for the worst is what Leistera says is important to ensure people stick to the rules. Natalie Collada, CBC News, Toronto.
So many of us staying at home has not only eased rush hour traffic in the city, it's clearing the air as well. Satellite images obtained by CBC News show there has been a reduction in air pollution levels in Toronto. Oshawa, Brampton, and Hamilton have also seen declines. Greg Evans is a professor at the University of Toronto, where he heads the Southern Ontario Centre for Atmospheric Aerosol Research. So, Greg, you've been tracking COVID-19 as it relates to the environment. What is the relationship between air pollution and the respiratory illnesses like this one?
Well, we know that exposure to air pollutants can weaken our respiratory systems. So there is speculation that there is a relationship between exposure to pollutants and poor outcomes when people do get infected with COVID-19. That's partly based on a paper that came out of China where they did some work looking at what happened with SARS.
Now the satellite images show us that the impact of emissions produced by cars, trucks, and power plants, it's gone down as we fight COVID. Now, will this have positive effects on our health and the environment overall?
Well, we hope it'll have positive effects, and we should emphasize that Canada has very good air quality in general overall, and because of the shutdown, it's gotten even better. So this may be an edge that we have in Canada in terms of being able to fight COVID-19, but there are really things that need to be found out. So, for example, those satellite shots, they're very useful and they do indicate a reduction, but it's just one pollutant, and it's a useful pollutant, but there's many others. And so we really have no idea which pollutant or which emission sources we should focus on. That may become a factor this summer, for example, if there's forest fires where we could get people being exposed to higher pollution for a week or so because of it. And so that's something that we'd like to be able to give some proper guidance on, but we really don't have the information yet. So that's why we're tracking this very carefully.
I've read some articles from environmentalists where they say we have seen some gains around the planet in certain manufacturing hubs. So we made some short-term gain here. Will we lose this all when things get back to normal, Greg?
Well, who knows? Let's hope. The new normal is something that we're all wondering about, but really what we see here is how quickly air quality can improve when we shut down the emission sources. And what we're going to also find out as this goes on is exactly how much it can improve. So it'll give us a target for the future, but it's anyone's guess as to whether we're going to be serious about pursuing that target.
Greg Evans is a professor at the University of Toronto, where he heads the Southern Ontario Centre for Atmospheric Aerosol Research. Greg, thank you for joining us, sir.
It was a pleasure to join you.
And this opportunity came up, and we were asked if there was somebody we wanted to recognize with our screening team. It was immediately unanimous with our leadership team that we absolutely had to recognize you.
After the break, my favorite part of the show, we head to Sick Kids and introduce you to today's Frontline Hero. Lindsay Chapman is a screener on the front line at Sick Kids. She helps to identify potential cases of COVID-19 before they can enter the hospital. We are recognizing her today as our frontline hero. Chapman's colleagues sent us a message about her efforts. They also surprised her with a tribute at work.
What are you doing? Oh my God. You know that we have nominated you as our healthcare hero. Oh my God. What is happening? You've been an incredible asset, and we wouldn't have gotten through these last 2 weeks without you on the ground, supporting the staff in such an incredible way, helping families go manage these really difficult situations. We're really, really fortunate that you stepped in and we threw you into a situation that was so new for all of us, and you've completely just overwhelmed us with how amazing you've been. Yeah, and I want to just add, I think your generosity in giving us your time, but then also your skills as a social worker to help patients and families has been honestly invaluable.
Supporting the staff and both patients and families go through a really difficult time is truly an honor for me. And I just feel I'm just happy to be here and happy to do what I can. So I'm overwhelmed. Thank you all so much.
No, thank you, Lindsay, for everything you are doing. If you'd like to share a story about your frontline heroes, send us a selfie-style video explaining why they are a hero to you. Just email us at torontotips@cbc.ca, tag us on Twitter or Instagram @CBC Toronto, or send us a message on Facebook. Premier Doug Ford gave a shout-out to one of his own frontline heroes today.
Shows up every single day to help with sign language is Christopher behind me. And Christopher, do you have a minute for just to come up here for 1 minute? I apologize. You can take over the sign language, but this gentleman shows up, never complains, never says a word. And I told him today how many comments and emails and phone calls I get about you. My friend, you're a champion, you're a rock star, helping people in the deaf community, and it's so important, the role you're playing.
We're trying to make sure that all deaf Ontarians have access, and we're moving to include deaf interpreters. And deaf interpreters make sure that including deaf children and deaf adults and everybody can understand the message clear to keep themselves safe from COVID-19 and be able to follow the very important messaging that Premier Ford is sharing with us.
It was Chris's last day on camera, but he still will be helping out as other ASL interpreters going forward. That's our show for tonight. Thank you for joining us. Power and Politics is coming your way next.